Hello, so today we're going to talk about the Musculoskeletal Assessment module. So let's begin. Bones provide a framework of the body, protect structures. They are levers for movement, produce blood cells, store fat and minerals. Yellow bone marrow in the long bones contains the fat and connective tissue as opposed to the red bone marrow from the sternum, ribs, and ilium that produces red blood cells. Muscles can be voluntary, such as with skeletal muscles, for example, the deltoid muscle. Involuntary, also called smooth muscles. An example is the diaphragm or bladder. And cardiac muscles, which obviously are the walls of the heart. There are over 600 skeletal muscles made up of thick bundles of parallel fibers, each muscle fiber made up of the smaller structure myofibrils. Skeletal muscles contract with the release of acetylcholine, and the more fibers that contract, the stronger the muscle contraction. A joint is a point where two or more bones in the body meet. Fibrous joints are found in the sutures joining the bones of the skull. Cartilaginous joints are joints that join bones with cartilage, such as the vertebrae, and synovial joints are fluid-filled joints filled with synovial fluid. These are limb joints, and classifications include plane, hinge, pivot, condyloid, and saddle. Joint movements include gliding, flexion, extension and hyperextension, abduction and adduction, circumduction, rotation, supination and pronation, inversion and eversion, protraction and retraction, elevation and depression, and opposition. So we are going to go over these in the next couple slides. Gliding is a simple joint movement with flat bones sliding over one another. So you can see that demonstrated in the picture on the top. Flexion is a bending movement that decreases the angle of the joints, bringing the bones closer together. An extension, this is an increasing in the angle between the articulation bones. And you can see that in the lower picture. Adduction is the movement away from the midline plane of the body. And adduction is the movement toward the midline plane of the body. Circumduction is the movement in a circular or cone shape. Rotation is the turning movement of a bone around its own long axis. This can be toward the midline of the body or away from it. Supination is movement of the radius around the ulna. The palm faces up. And pronation is movement of the radius around the ulna and the palm. Actually, the palm faces down. In supination, you would hold a can of soup versus pronation, it would be down. Inversion, the sole of the foot is turned medially. Eversion, the sole faces laterally. Protraction is a non-angular movement in a transverse plane, and you can see that in the bottom picture. And retraction is the non-angular posterior movement in a transverse plane, and that's also in the bottom picture for you to see. Elevation is lifting a body part superiorly, and you see that elevation of the mandible, versus depression is moving of a body part inferiorly. And opposition is movement of the thumb in relation to other digits. I have included this table to see grading of muscle strength. 0 would be no contraction and total paralysis. And 5 is full strength of full range of motion against full resistance. The temporal mandibular joint permits articulation between the mandible and the temporal bone of the skull. It allows the opening and closing of the lower jaw, protraction and retraction of the lower jaw, side-to-side movement of the lower jaw. The shoulder is a ball and socket joint. Its head of the humerus articulates in the shallow glenoid cavity of the scapula, and I've included the different degrees of abduction, adduction, flexion, circumduction, external rotation, and internal rotation. The elbow is a hinge joint that allows articulation between the humerus of the upper arm and the radius and ulna of the forearm. The wrist consists of 2 rows of 8 short carpal bones connected by ligaments. The distal row articulates with the metacarpals of the hand. The wrist can extend, flex, hyperextend, radial deviation, and ulnar deviation. The hand has metacarpophalangeal joints, and each finger has interphalangeal joints. Finger movements are abduct, extend, hyperextension, flexion, and circumduction. The thumb can extend, flex, and also opposition. The hip is a ball and socket joint. It has a rounded head of the femur and it fits into the acetabulum cavity. And it can extend, hyperextend, flex, internal rotate, external rotate, and abduct and adduct. The knee is a complex joint of the patella, femur, and tibia. It can extend, flex, and hyperextend. The ankle is a hinge joint that accommodates articulation between the tibia, fibula, and talus. Plantar flexion of the foot is the foot moving down. Dorsiflexion is the foot moving up, so the foot would flex up towards the patient's nose. It also does inversion, which is moving the foot inward, and eversion, which is moving it out. There are 26 irregular bones called vertebrae, 7 cervical that support the base of the skull and the neck, 12 of the thoracic vertebrae articulate with ribs, 5 lumbar support the lower back. The sacrum shapes the posterior wall of the pelvis, offering strength and stability. Coccyx is a small triangular tailbone at the base of the spine. The neck and spine can flex, extend, hyperextend, laterally flex, and rotate. Special considerations when performing the musculoskeletal assessment on a patient. Remember that the delivery process can cause musculoskeletal abnormalities in the infant. Neonates have flat feet, and the arch is actually developed during preschool. They tend to be bow-legged before walking, and by 4 usually knock-kneed standing, and this does resolve spontaneously, typically. Checking neonates for tufts of hair, because that can indicate spina bifida, which is a congenital neurotube defect. The picture above shows an infant with a meningeal seal. Assess for congenital hip dislocation up till 1 year. Look for unequal growth of legs or a clunking on inspection. Check for shoulder muscle strength by holding the baby under the axillae. Infant remains upright between the nurse's hands. Bone growth is rapid during infancy and continues at a steady rate during childhood till adolescence. And both girls and boys experience a growth spurt during this time frame. Checking for scoliosis in children is also another special consideration, and remembering that pregnancy changes in the lumbar spinal curvature as the later in the pregnancy as it progresses. Some abnormalities of the spine include kyphosis is an exaggeration of the normal convex curve. Lordosis is an exaggeration of the normal lumbar curve, and scoliosis is a lateral curvature of the spine. Older adults change due to decrease in calcium absorption and reduction in osteoblast production, causing osteoporosis. The vertebrae and long bones are most affected by older adults, decreasing bone density, contributing to a shortening of the vertebral column. Abnormal findings include looking for osteoarthritis, resulting in pain and stiffness. It's associated with osteoarthritic changes in the spine, knees, and hips. Rheumatoid arthritis is inflammation of the synovium of the joint, occurs in rheumatoid arthritis. The inflammation leads to pain, swelling, damage to the joint, and loss of function. Rheumatoid arthritis affects the hands and feet symmetrically. Juvenile rheumatoid arthritis is a form of arthritis that can affect any body part. Inflammation causes pain, swelling, stiffness, and loss of function of joints. Symptoms may include fever and skin rash. Systemic lupus is an autoimmune disease. The autoimmune response results in inflammation and damage to joints and other organs, including the kidneys, lungs, blood vessels, and heart. Fibromyalgia is a chronic disease that is characterized by pain in the muscles and soft tissues that support the surrounding joints. Pain is experienced in tender points of the head, neck, shoulders, and hips. Gout is a type of arthritis caused by uric acid crystal deposits in the joints. The deposits cause inflammation, pain, and swelling in the joint. Infectious arthritis refers to a joint inflammatory process that occurs as a result of bacterial or viral infection. Infectious arthritis can occur as a paravirus arthritis and also that found in Lyme's disease. Bursitis refers to inflammation of the bursae, which is the fluid-filled sac that surrounds the joint. The pain of bursitis may limit range of motion of the affected area. And tendinitis is overuse or inflammatory process that can result in tendinitis. The inflammation of the tendon results in pain and limitation in movement. Trauma-induced disorders. Dislocation is displacement from the usual location. A sprain is a stretching or tearing of the ligament due to movement beyond normal range of motion. Fracture is a break in the bone. And muscle strain is a partial tear from overstretching of the muscle. You can see at the bottom that there's a grading of it. Grade 1 is just pain, 2 includes weakness, and grade 3 actually has loss of function associated with it. So whenever doing the assessment, we use the acronym OLD-CART and ICE. If the patient is in acute pain, then provide pain relief before moving on to more in-depth assessment. You are going to ask about the onset, location, duration, characteristics, aggravating factors, relieving factors, treatment, impact on activities of daily living, coping strategies, and emotional response. So this will conclude the first part for this module, and please review the second part of the musculoskeletal assessment in the next video.